What does vitamin C actually do for your skin? You've probably heard it all. Vitamin C is essential for collagen production, which in theory helps with skin regeneration. It's also an antioxidant that in theory can protect against sun damage. But let's set aside the theories, the marketing, the influencer reviews, and overhyped promises. Instead, let's focus on what human clinical research tells us. No biases or conflict of interest, just the facts. What do clinical trials tell us about the realistic benefits of using vitamin C for skincare? You may have heard the term vitamin C and ascorbic acid used interchangeably, but are they the same? Not exactly. Ascorbic acid is a single compound, which is the most pure and simplest chemical form of vitamin C. Vitamin C, on the other hand, refers to all the different chemicals and compounds that exhibit vitamin C activity, meaning they act like vitamin C in the body. For example, compounds like sodium ascorbate, calcium ascorbate, and all the other mineral ascorbates are all considered vitamin C just like ascorbic acid. Although these compounds differ, the body metabolizes them all to use as vitamin C. So if they all end up as vitamin C in the body, do different types of vitamin C have different effects on the skin? Absolutely. Each form of vitamin C has different stability and chemical properties. For example, ascorbic acid, while being the most widely studied form of vitamin C for the skin and form most commonly used in topical serums and cosmetics, doesn't penetrate the skin well and quickly breaks down when exposed to air. To address these issues, manufacturers and researchers have developed various methods. One approach is to reduce the acidity of ascorbic acid, which can improve its stability and skin penetration. For example, combining ascorbic acid with ferulic acid, another powerful antioxidant, helps stabilize vitamin C and protect it from degradation. Another strategy involves creating vitamin C derivatives by combining it with other stable molecules. Common derivatives include ascorbyl 6 palmitate and magnesium ascorbyl phosphate, or MAP, both of which are highly stable at low acidity. Other examples are disodium isostearyl ascorbyl phosphate, ascorbic acid sulfate, and tetraisopalmitoyl ascorbic acid, or VCIP. Studies show that these derivatives are much more stable than regular ascorbic acid. However, stability alone doesn't guarantee better vitamin C delivery. Some studies show that daily application of these derivatives does not increase ascorbic acid levels in the skin. This could be because the derivatives are too stable and don't break down efficiently to release vitamin C into the skin. We need to find the right balance between stability and bioavailability to help determine the best form of vitamin C to use for specific skin conditions. When it comes down to how much to use, the optimal concentration of vitamin C depends on its formulation. Typically, a product needs a vitamin C concentration higher than 8% to be biologically significant. Studies show that concentrations above 20% don't increase benefits and may cause skin irritation. That's why most reputable skincare products contain around 10 to 20% vitamin C. It's important to note that most of the studies on vitamin C for skincare use pure ascorbic acid, not combined with ferulic acid or in its derivative forms. This doesn't mean that these other formulations aren't beneficial, but the overall weight of evidence suggests that using ascorbic acid is likely just as good in most cases for skin health than the other newer, fancier formulations. With that in mind, let's start with vitamin C and wrinkles. Does vitamin C help reduce wrinkles? By the way, we're talking about wrinkles due to aging in general, not those caused by excessive UV damage. We'll cover those later in the video. Some evidence shows that applying vitamin C to the skin for 12 weeks can reduce facial wrinkles. A small study found that using a microneedle patch containing vitamin C every 4 days for 12 weeks reduced the appearance of crow's feet. Another study with women aged 30 to 60 years showed that applying an oil-soluble cream containing the vitamin C derivative tetraisopalmitoyl ascorbic acid, or VCIP, twice daily for 8 weeks reduced wrinkles compared to a placebo. So it appears that topical vitamin C may indeed help reduce the appearance of wrinkles. However, these benefits came from specialized formulations that improve vitamin C absorption into the skin, such as oil-water emulsions, oil-soluble derivatives like VCIP, or microneedles to drive the ascorbic acid into the skin. Simply applying pure ascorbic acid to the surface of the skin likely does not have the same effect. Additionally, these studies focus on topical applications, not oral consumption, and there's no evidence that taking vitamin C supplements can help with wrinkles. It's important to note that this is not the same as having anti-aging effects. While vitamin C may reduce the appearance of wrinkles, there's no evidence that it can reverse or slow down the natural aging process of the skin. What about UV protection? Does vitamin C help reduce sun damage, also known as photoaging? Applying topical vitamin C along with vitamin E and melatonin seems to provide modest photoprotective effects when used before UV exposure. However, topical vitamin C has no benefits if used during or after UV exposure. That being said, oral vitamin C may have benefits after UV exposure. Taking vitamin C with vitamin E appears to prevent UV-induced redness and also protect against skin inflammation after UV exposure. So vitamin C may slightly protect the skin from UV damage. However, in these clinical trials, ascorbic acid was always combined with another antioxidant like vitamin E or melatonin. This makes it hard to determine if the beneficial effects are from the ascorbic acid itself or the other antioxidants. Both topical and oral forms of ascorbic acid were used. Topical ascorbic acid didn't require any special emulsions and acted like a weak sunscreen. The key here is freshness, as ascorbic acid degrades quickly when exposed to the environment. This means that preparing your own ascorbic acid solution or cream to use might actually be a viable alternative to other commercial vitamin C formulations for sun protection and may help block sun damage if applied before exposure, but likely has no effect if applied afterwards. If you want to reduce sun damage after exposure, taking vitamin C orally may be the way to go. What about acne? Does vitamin C help with acne or acne scarring? One small clinical study showed that applying a vitamin C serum to the face after a microneedling treatment for 4 months improved the appearance of acne scars compared to the baseline. However, no statistical comparisons were conducted, so we really don't know how significant the benefit was. In another small study, a vitamin C derivative called ascorbyl 2-phosphate was applied topically for 12 weeks and showed a small improvement in acne. So there is weak evidence suggesting that vitamin C, specifically ascorbyl 2-phosphate, may slightly help with acne. Vitamin C may also help reduce acne scarring, but only when used with microneedling. Microneedling, also known as collagen induction therapy, involves using fine needles to create tiny controlled punctures in the skin. These micro-injuries stimulate the body's natural wound healing processes, leading to the production of new collagen and elastin. For acne scars, microneedling can improve texture and appearance by breaking down old scar tissue and promoting the formation of new, healthier skin. It seems that applying vitamin C during this treatment can help improve healing. What about dark spots? Does vitamin C help with hyperpigmentation? In a small study involving women with melasma, applying a 25% vitamin C solution with a chemical penetration enhancer decreased pigmentation caused by melasma after 16 weeks. Another small study found that a vitamin C derivative, magnesium ascorbyl phosphate or MAP, slightly reduced pigmentation. However, none of these trials were placebo-controlled, so the research on vitamin C for dark spots is weak and has primarily focused on hyperpigmentation due to melasma. Melasma is a common skin condition that causes dark, discolored patches, mainly on the face. It's more prevalent in women, especially during pregnancy or when using oral contraceptives, and is often triggered by hormonal changes and aggravated by sun or UV exposure. Overall, there is some evidence that vitamin C and some of its derivatives can benefit various skin issues. It has decent evidence for reducing the appearance of wrinkles and protecting against UV damage. If you're using it for wrinkles, you'll need to ensure that you're using a formulation that will promote ascorbic acid absorption into the skin. If you're using it to prevent UV damage, you'll likely need to combine it with vitamin E and use it before sun exposure. However, the evidence is much weaker for helping with acne, scarring or reducing pigmentation. The benefits are likely small, and you may not notice much unless you use specialized tools to examine your skin closely or meticulously count your acne or wrinkles. Ascorbic acid is probably the most beneficial form of vitamin C for these conditions, although some of the derivatives like VCIP, ascorbyl 2-phosphate, and MAP have shown potential benefits. Hi, I'm Dr. Brian Yeung. Have you used vitamin C for your skin, and what are your experiences? Let me know in the comments down below. And if you found this video helpful, please subscribe to the channel and leave me a like. Hit the notification bell if you want to stay up to date, and share this video with someone you know who needs the info.